Good afternoon, everyone. My name is Aruna. I am excited to be here today to share my presentation with you all. I hope you are ready to learn something new. Okay, let me start the presentation. Today, I want to talk about reducing tobacco use and nicotine addiction in people in low socioeconomic group. Let me start with non-communicable disease. Non-communicable disease is defined as a medical condition that are not infectious and cannot be transmitted from one person to another person. For example, non-communicable disease includes cardiovascular disease, cancer, respiratory diseases. In 2019, in Australia, the low socioeconomic group smoked every day at a rate of 34%, while the high economic group smoked much less at around 9%. Also, depending on how rich or poor they were, people smoked different amounts each day. The poorest group smoked around 40 more cigarettes each week compared to others. Now, let me discuss about the main risk factors of non-communicable diseases. There are different risk factors according to the people and people lifestyle. So, the main risk factor include the primary modifiable risk factor contributing to non-communicable diseases compromises behavior elements such as tobacco consumptions, sedentary lifestyle, poor dietary habits, and excessive alcohol intake. Alongside, biological determinants includes obesity, hypertension, hyperlipidemia, and hyperglycemia. There are also behavior and biological risk factor. Risk factor pattern may be vary according to a place and lifestyle of people. As a primary healthcare nurse, I am committed to implementing various methods to reduce tobacco use and nicotine addiction, especially in low socioeconomic groups. Moving forward, in my opinion, one of the very effective approaches can be health promotion plan that may tackle in various factors like poverty, education, and access to healthcare. Behavior counseling also plays a vital role, which typically consists of several sessions, often 4 or more, with a total contact time planned between 90 to 300 minutes. Interventions with 8 or more sessions tend to have the greatest impact, although the difference in effectiveness between the number of sessions may not be significant. In future, I have also planned to use other various strategies to help people quit smoking, especially in low socioeconomic group. The strategy includes offering personalized counseling and support to the people who are more vulnerable and who want to quit smoking, as well as running campaigns in community to provide education about the effects of smoking and encourage them to use citation services. Now again, moving forward, as a nurse, I have gained a various new knowledge and understanding about non-communicable diseases and tobacco use in low socioeconomic group. Firstly, I have got insight about how different factors like culture, personal choices, standard of living affect and why the people from low socioeconomic group influence on smoking. In my experience, understanding and respecting people's view towards smoking while also giving them a real fact about how the smoking is affecting in their health. Also, as a nurse, I can also be able to recognize the low socioeconomic group people smoke due to lack of proper education, healthcare, and jobs. Now let me discuss, being a nurse, what type of technique I will use to quit smoking. Being a nurse, I have improved my ability to use motivational interviewing technique to help people quit smoking. You may think how I can do this. Firstly, I will create interpersonal relationship with the people who is willing to quit smoking, which will feel them more confident in quitting smoking. From this, I have also learned that how the goal setting and problem solving collaboratively make easy for people, especially with low socioeconomic group, to make change in their behavior. In my experience, evidence-based information to give knowledge have been effective. Being a primary healthcare nurse, I have also planned to provide education about improving physical health, increasing stamina, and management of chronic non-communicable disease. In my future, being a nurse, I gain knowledge about helping low socioeconomic group people plays vital role in my nursing work. I will also make sure to give continuous care that reflect and respect different cultures and understandings that the actual need of the people. Also, I will plan for the better rules and regulations to make sure that every people from low socioeconomic group has fair chance to quit smoking and stay healthy, especially who have no opportunities. So in conclusion, It is evident that smoking is harmful to every age group and every economic group. In my future nursing career, I will play a critical role in minimizing smoking and promoting healthier life in every age group and economic group. Smoking is hateful to the nose, harmful to the brain, and dangerous to the lungs. Okay, if you have any question regarding the topic, please feel free to ask the question. I hope you get a good knowledge about the tobacco use. And thank you all for coming today and have a good day. Thank you.